Hey friends, thanks for joining me, Jim Baroud, to hear a few insights from leaders who represent our innovation ecosystem. Today's chat is with Anjalee Khemlani, a senior healthcare reporter at Yahoo Finance. Tell us about your journalistic career from the very beginning, because it really is fascinating. Go ahead.
Well, I'm glad you think so. I just see it as an eternal struggle, but for sure, we'll definitely start at the very beginning. The very beginning was me working at a small beachside newspaper in Florida, in Jacksonville, Florida. And from there, I moved up to the Press of Atlantic City, which I worked at for 2 years, another beach town, if you will. But definitely it was an interesting pace for me, and also a different environment altogether, because I was a Florida girl my whole life. And why did I accept living in a snow-filled place? I, to this day, question that, but 10 years later, here I am. And then I took a quick break, actually, from the New Jersey area after a couple of years at the press. I felt like there wasn't enough growth opportunity for me, and just a lot of internal politics that made me want to leave. So I just decided to pack my bags and take the first job that would take me. And that landed me at an interesting place known as RT. And that was in Washington, D.C. I worked for the Russian television, and it certainly gave me some interesting perspective into how media operates with international ties, and especially with one as contentious, especially for the US, as Russia. And then from there, didn't really see again too many growth opportunities. So I decided to just jump ship again. And the first place that would take me landed me back in New Jersey. And that to me was sort of a sign that I just needed to get back to the Garden State. But what was really interesting was that this position was for covering healthcare, and covering healthcare from the business perspective. Till then, I had been covering general news, breaking news. I'd been on, whatever the hot topic was in the region or nationally with reference to RT. But this was the first time that I really had a very specific beat. And I was concerned that I would get bored too quickly. But as you probably know, healthcare is not boring at all. And so I have stuck it through, and 6 years later, I'm still here. But from covering healthcare for NJBiz, I then decided to join forces with my then editor and now mentor, Tom Bergeron, who chose at a time where NJBiz was undergoing a change of ownership to start his own publication along with a team that was actually from NJBiz. And that was what some people consider brave, and what I just consider the practical decision at the time, considering what we were facing. I'd already been through a buyout previously, and of course Tom Hughes was also, they both had been at national publications and just larger publications that have gone through this. So they also understood what the changes meant, and it seemed like the right thing to do at the right time. And that was probably one of the best decisions and most rewarding career changes I've yet to experience. It was interesting to be part of a startup. It was interesting to be part of a startup in a market like New Jersey, which, for all of its links to the broader New York or Philadelphia markets, is actually kind of deserted when you look at it from just the New Jersey region perspective. And so to be able to add an additional organization, additional voice to the business landscape was just so rewarding, and to be able to work there. And then after a couple of years, I just decided that, I needed to move on. And it was probably the only time that I was heartbroken to actually leave a newsroom behind in my entire career to date. It was a great team, hardworking people, an amazing experience, an amazing workroom, an amazing beat. I ended up expanding beyond healthcare to cover also New Jersey politics. And that gave me the opportunity to cover a number of incredible events, including the one for me that was, of course, the most rewarding was covering the governor's missions abroad, and that was economic missions abroad, and that was fun for me because I love traveling. So I think I've droned on quite long enough, but that's sort of where I've been.
And so bring us up to date. So you're at Yahoo Finance,
Right.
and what's your focus there?
So here I cover everything healthcare. And what that means, of course, is everything COVID. And that has been a very challenging role, but also very rewarding. I consider myself lucky to be one of the people who had any experience in healthcare before this and to not be playing catch up to the beat while the pandemic started. And I was pretty well positioned to be able to take on the role of being the senior healthcare reporter at the start of the pandemic. So that's basically all I cover now. Prior to the pandemic, I had definitely done a little bit more when it comes to business reporting and finance reporting in healthcare. That has unfortunately taken a backseat just because there are only so many hours in a day. So a lot of focus there. I also now actually, because going back to my previous comment of being heartbroken of leaving ROI, I decided after a quick chat with Tom Bergeron to return to ROI in some capacity, and that is as a columnist to focus on diversity. So those are my two hats right now.
That's fascinating. And we'll get to the diversity later, but let's talk about Yahoo Finance. That's a national organization, right? And it seems like they're breaking a lot of news lately. They've been on a tear. So talk to us about that sort of culture and that change.
Yeah, it's a great organization. It is definitely national. We also have some different bureaus, both over in Europe as well as Canada. And we have a link to the broader Yahoo infrastructure, which is actually international. So it's a very big company and just full of incredibly talented people. I am amazed on a daily basis, like the amount of news that gets churned out. It is so rewarding to work alongside people like this, and it feels good to be able to have that talent sort of in the same pool. But it is a really, I don't necessarily think flexible is the right word, but definitely quick to respond to news, as well as has developed really good relationships, and again, that speaks to the talent. But it's also really interesting because they're not afraid to try new things, and I think that is really important in this day and age. So for example, I cover healthcare on air and I write reports, but I also have TikTok videos every so often. And at first, when they asked me, I kind of flashed back to when Twitter started becoming a big thing. And some of the veteran journalists were like, oh God, you want us to do what at the same time as reporting? Or, when reporters started becoming photographers and video journalists all at the same time and just being jacks of all trades. And for me, I had a moment where I was like, okay, this is very interesting. I actually do not like the platform. I'm not on it, but maybe there's some value there. There's clearly some value there for them to get into it. So I kept myself open to the idea, did my first TikTok video and kind of liked it. I was like, this is fun. It's fun to be able to distribute the same information on a different platform and utilize it and make the most of the various opportunities out there. So I think that kind of made me feel really comfortable about working in this environment.
I didn't know that, Anjalee. So where can we find you on TikTok?
Well, I do have an account, but I really don't use it. But I believe that handle is @Khemlani, but don't hold me to it. But if you just go to the @Yahoo Finance handle, you'll see my videos there.
Got it. And what about Twitter? I know you're active on Twitter. Is that platform, how do you see that? How has that evolved for you?
That has evolved in a very interesting way. If you speak to most journalists, you'll see it as a portal into what some see as sort of a journalism echo chamber. and I see where they come from, those who say that. I do still think there are sort of your average persons on there who interact, but it's safe to say that my interactions are largely either trolls, other reporters, or experts and officials. And I think they know that that's the way to get it. So if you want to get information from reporters directly, that's the platform to be on.
Got it. Now, you must be exhausted from COVID.
That's an understatement, Jim.
But you've done such great reporting. I mean,
thank you.
I think Dr. Fauci was obviously one of the top people you interviewed. Talk to us about some of those experiences and what's been sort of a highlight and what's been sort of maybe not so rewarding or demoralizing. Can you give us sort of both sides of that?
Yeah, absolutely. So let's do the fun part first. Yeah, the highlights. There are plenty, because this past almost 2 years has definitely been, I mean, you could just make a highlight reel out of that, to be honest, if you were to flash back in terms of just general coverage. But probably some of the most interesting conversations are from the people you would expect, from Dr. Fauci, who was absolutely incredible to speak with, Dr. Walensky as well, the various vaccine company CEOs, Albert Bourla over at Pfizer, Stefan Bancel over at Moderna. I also did speak to J&J and Novavax. So it's been pretty interesting to speak to some of these people pretty soon after they've made some pretty important decisions. And I think that's where you sort of realize just how much of a burden they have to carry. And you can appreciate that, because on any other given day, business as usual, new programs, new products, that can all just kind of come and go. But in the middle of a crisis, for them to take the time and speak to our audience about that is pretty powerful stuff. And so what is it? Sorry?
What about something that was really negative in your experiences?
I would say that what the demoralizing part probably comes from the struggle and anxiety that everybody is feeling. So to have to chase a lot of this stuff at the same time as everyone else, and just know that the industry has gotten to a point where we're all clamoring for the same information, and we're all clamoring for exclusives or for something interesting. To have to feel like you're still in that competition mode when there's a lot of really important stories out there and a lot of reality that's happening at the same time, it's sometimes you just feel like you're not making a difference at all with what you're doing. I think that's something that I have felt through this pandemic, is just, how am I making a difference in what I'm reporting? Am I actually getting the information that the people want? Or is this just an exercise in futility?
Right. That's so interesting. The government in general, right? You sort of covered 2 administrations now, right? How is that different for you?
So what's interesting is that there are some obvious changes in just how information is being provided and the access and the type of responses that you get for requests. But to some degree, there's also a similar type of close hold on certain things that you're experiencing. And I've talked to other reporters about this too. So, but I would say, just generally speaking, it feels, someone actually told me this, and I kind of agree. It feels a little bit more maybe not expected, but it definitely feels a little bit more predictable in terms of what we know about covering this virus, what we know about the way the government is operating. And that is maybe a little bit helpful in being able to cover better, to be honest.
Yeah, that makes sense. When you look globally and you look at other countries, is there one country or two countries that you wish we could have emulated better as we sort of look back and Monday afternoon quarterbacking?
I think some of the Asian countries clearly had a handle. I mean, they still weren't able to stop those, Australia too, by the way, definitely they did a pretty good job. But it seems like every country has been impacted. Every country has seen a surge, to some degree, or not been able to entirely stop cases from coming in. I don't know that we could have implemented any of the same measures. So to say, I wish we could have done this, probably not, but I wish we could have paid more attention to the alarms being sounded by public health experts and those who really knew what they were talking about, because that has been really the most heartbreaking thing. Maybe I should have said that for demoralizing for sure, because, to hear some of the same people say the same exact things and give the same advice for more than a year. I mean, some of these people are exhausted from trying to convince people that science is not a hoax and it's not fake news. And, there really is some basis for some of these recommendations and some of the strategies that are being pitched. And just watching how quickly people are willing to believe that something is false or that there's a conspiracy or something like that.
Right. No, I hear what you're saying. That's that definitely can start to be really demoralizing.
Very. So to your point of, to the question of, is there someone we could have emulated? No, because I even heard over in Europe, I mean, I have friends who live there. I know that even they struggled with information. So I think it's just a global problem. And I wish we could have not been where we are now.
What about the origins of this virus? You hear differing reports. What's your best guess as to how it originated?
Oh, that I have zero expertise in, but the experts who do have expertise that I have spoken to all seem to believe that the animal theory is the most likely one, the one where it jumped from an animal to us, because in the history of, viruses like this, there is always an animal. So I tend to follow that. I mean, I know that a lot of people are starting to, especially increasingly, due to the Wuhan Institute report, discuss a lab leak theory. And I know some health experts who have said it's not entirely improbable, but the likelihood of it is very small compared to the animal theory.
Right. Now, thinking of your home state and your adopted state, how do you view how each state handled it?
Oh, I mean, Florida is living up to its reputation in some ways. It definitely did not handle it as carefully as New Jersey did. I think Governor Murphy played a far more conservative strategy than Florida did. And you're seeing it in just sort of how each state has seen surges and how they've been able to manage it. But also there are different factors to consider. And I think when we think about, who's handling it better, we think purely from the political lens. I think that if I were living in an area where I'm not, living on top of other people, I'm not necessarily living close to people or as closely as you do in some of the crowded urban areas of New Jersey, I would probably think, if I were just, a logical human, that that I probably have a better chance of not catching the virus in such a space. But the problem is that, you discount the fact that you live with other people, period, and that you're going to interact with them. And so I can see how some people were convinced that this is, if you don't catch the flu every year, then you're probably not going to catch COVID. I can see how that would work. So I think that looking at it from the ground level, from where people actually are and where they live and how they live, it is really important to consider when you're judging how each state handled it. Does that mean that the strategies and the, trying to fight a vaccine mandate or trying to fight any mandate or trying to offer monoclonal antibodies in a tent is a better option? I think most health experts would say no. But you kind of get a sense of just how diverse this country is as a result.
Right. That's for sure. So what's your best guess as to when we'll be able to breathe easy with regard to COVID?
Really, Jim? Every health expert doesn't know. No one knows this. As everyone has been saying, this virus has been humbling. You never know what's going to happen. You don't know if we're going to ever face that one variant that escapes vaccines. But if I were to predict for the US, probably by March, we'll either be breathing easy or we'll have a much better sense of when we'll be breathing easy. And the factors that go into that, in my mind, we will probably have more production and availability of testing. We will have boosters. We will have kids ages 5 and up vaccinated. And by then, I think we'll also be over whatever this anticipated winter surge is, because the experts are definitely pointing to one. So all those factors considered, maybe if the surge comes late, in January or February, like this past year, maybe by March we can breathe easy, is what I would think.
Got it. Okay. Thank you for that.
Yeah.
So let's see, let's switch gears here. So now you've been covering, as you mentioned before, diversity for ROI. And that's a big topic these days. Talk to us about your decision to do that.
Well, actually, Jim, it's actually not something new for me. I've been covering diversity since I started in this career. And I say that because of two specific things. Number one, in most newsrooms throughout my life, except for the one I'm currently in, I was the reporter of color, the only reporter of color, or one of 2, maybe. And that often meant that the burden of covering diversity fell on me, because there were angles to stories always that were being missed. And I would either point them out or pick them up myself, to the point where I tell this story all the time. When I was working at the Press of AC, there was one story that I thought was really important to tell when the casinos were shutting down, because what people didn't realize is that there were a lot of immigrants in that area, a lot. And a lot of them were working in those casinos or were driving the cabs in the area. And no one had written that story. A lot of people had written the broader impact on casino workers in the area. But what I found out after digging in was that not only were these immigrants laid off and didn't know where to go and what their next job would be, but also were kind of moving in groups. Like, you could almost down to like the ethnicities, you could tell there was like an entire neighborhood of Chinese immigrants who moved to Maryland. There were Nigerians and Liberians who were moving out to North Dakota to get a job. And so it was just really interesting to watch that. And I pitched that story, and there was a lot of trepidation because, they'd never really covered something from that angle before. And they were concerned that it was going to seem like they were favoring immigrants over, kind of exactly the issue that's dividing this country, that immigrants were being favored over, or their stories were being considered more important than just all Americans. And so I was actually told not to do that story, but I pursued it anyway. And it ended up running on the front page after I got it done. So things like that. And I know that other minorities face the same issue. So I have been pushing for broader coverage, for better coverage for 10 years now. And it just seemed like the right time to make it a priority, because there is momentum. And I think that, you and I both know John Harmon. He and I have chatted about this, and it is definitely different this time. Ever since the protests following George Floyd's death, there has been far more attention to the needs of diverse communities, whether you're talking race or abilities or, sexual orientation, whatever it is that you're talking about. There are a number of communities who have an opportunity right now to have their voices heard, because a lot of people are paying attention, more so than they have in the last several years. So there's a big movement happening. It's different this time, is what I keep hearing. And hopefully we can capture some of what's different.
Yeah, no, this is really important reporting. And it's you're taking the tack in a number of ways, right? Diversity in reporting, number one, right? Journalistic sort of landscape. But there's also diversity in business, right?
Yes.
And there's diversity in so many other areas, right? So talk to us about sort of what things you're looking forward to covering, or what things you've already covered that sort of can illuminate where we are as a country.
Yeah, absolutely. I mean, there's so much. I think what I'm looking forward to covering is definitely more important right now. I've already covered diversity in business for the years that I worked at NJBiz and the years that I worked at ROI. That was always something that I was allowed to pursue. And so that's been done. But what we need to do moving forward, and this is where I really hope, and I'm happy to share this because I don't want to be the only person doing this. I want more reporters to be inspired to cover it this way. We need to do more than just talk about what's happening. And we need to do more than just listen to the companies and their boards that are, strategizing. We need to actually be able to follow up. We need to follow up on these policies that are being pitched and see where are the gaps? Where are people's voices not being heard? What are some people actually doing to help the movement whose voices have not been elevated? So take an example for healthcare. For the longest time, we knew that community health centers, federally qualified health centers, existed, but their sole purpose was to help the underserved. So what's the story there? Well, now they've played one of the biggest roles in vaccine distribution and administration. The federal government has called on them. And we know that they've played a huge role in ensuring that more minority communities have access to these vaccines. So there needs to be a lot more discussion about the state of them and, who's actually helping them, who's been giving them oxygen this whole time, which hospitals nearby have ever partnered up with them or provided services or supported them, which philanthropies have, ever done anything with them. All of this stuff is really important to document, really just for history.
Yeah, no, absolutely. There's so much more to be covered, right? As you
so much more
as you look out into the landscape, right? And
yeah,
and the good thing is that there's more awareness, right? And that's part of it. Sustaining it is the other part, right?
Right. It can't just be, it's an interesting buzzy beat for now, and then let's ignore it later. Like I said, I've covered it for 10 years, but there are some reporters that I know who have been covering similarly and struggling to cover similarly for decades now. So there's a lot more attention on it. And I hope that it's more than just, this is a buzzy beat. We should definitely, do diversity.
Right. And just going back to, your healthcare sector, as I pointed out in a recent TED Talk, almost 1/3 of biotech workforce is are immigrants, right?
Yes.
And I think people don't realize how important they are, and the diverse populations are to, for example, our healthcare system, from elder workers, to home care workers, to nurses, to all the support staff, in addition to the researchers.
Jim, I'm so glad you brought that up because I know people don't realize it and think about it enough. And I've definitely run into it in my coverage over the years and realized it then, just like how many diverse faces I see or names I see in the process. And it's not just at the support level, it's also in the entrepreneurship level, the number of executives that are at these companies is incredibly diverse. And another thing too that people don't think about, we all know, I think broadly speaking, that in the tech sphere, there's a lot of diversity. You think about H-1B visa holders often, but what you don't realize is that they too power healthcare, because much of the software that some of these platforms rely on, much of the back end, the cloud service that healthcare relies on is run by these very same people. So even on the back end and invisible to most people, it's also immigrants that are supporting the system.
Exactly. And the more people that are aware of that, I think the better it is for everyone. It's just an American story. It is what makes this country so vibrant and so strong.
Absolutely.
Obviously, we're on the same page, but I think the communication and the awareness has to be raised for everyone. So I'm so glad you're working on that. That's really important. Just so important to the state and to the region, to the country, frankly. So hopefully we'll do some of that on the national at Yahoo one day too.
Well, stay tuned. We might be.
Yay! Well, this has been great, Anjalee. I really appreciate you sort of talking with me and sharing your story and sharing all the great work you've been doing and your insights. So why don't you leave us with a saying or something that we can think about as we move on?
Sure. I mean, there's tons of sayings out there, but I think if anyone were to try and think about what we've talked about, which is really just journalism and my passion for it, one quote I vaguely remember, and this is terrible because everyone always has a quote, but I vaguely remember this quote, and it's a Forbes writer who once said that for those who are really into it, and for those who really have what it takes to get into it, journalism is a highly rewarding career. And I think that the first time I read that, it really impacted me, because I always felt the passion, and most people who meet me know that it's there. And so that's really important to me, is that we're now facing a media landscape that is full of noise, and to be able to find the people who care, who are doing the job right, is really important. And I hope that people learn how to be more media literate in the coming years.
Amen to that. Well, you're a great role model, Anjalee, and if we have more of you, this world will be a better place. That's for sure.
Hey, I'll take it.
All right. Thanks, Anjalee. We'll see you soon,
you, Jim.
hopefully in person.
Absolutely. Count down the days. Thanks so much, Jim.
You're welcome. Thanks for joining us. I hope you enjoyed the show. Please like it, leave a review, and subscribe. See you soon.